In health news, tennis elbow usually results from the overuse of the forearm and the elbow joint, and in serious cases, the pain may become constant and quite unbearable. So Singapore General Hospital says it sees about 20 to 30 patients every month, and treatment can be challenging, especially when non-surgical methods fail. Well, SGH says it's solved the problem with a new surgical procedure, which takes less than 15 minutes, and 48-year-old Elaine Chew here is one of the 20 patients who went through the clinical trial last year.
The surgery is not painful at all, and then but compared to the pain that I have every night, it is so much. The surgery is tolerable, but not the pain every night that I face.
So to tell us more about the new procedure is Dr Joyce Koh from Singapore General Hospital. She's also the lead investigator of the local study. So doctor, thank you for coming in today. So we heard from Elaine earlier. She said, the pain's quite unbearable. Is this usually what your patients tell you?
Well, to a certain extent that's true. Sometimes it even disturbs their sleep. It can be unbearable in terms of disabling them from doing some of the activities that they have to do in their daily routine, or in preventing them from doing the things they need to do in their job, or or what they enjoy doing during their games.
So SGH sees about 20 to 30 patients every month. What are the common causes of tennis elbow apart from racket sports?
Well, contrary to common belief, racket sports are not really the cause of tennis elbow, although they can actually present with it. Surprise actually is housewives who tend to present with it because of some of the duties that they need to do during household chores, like mopping, wringing of clothes and all. Usually people in administrative positions who have to carry heavy files and engage in repetitive activities such as using the mouse.
So what would you say are the common symptoms then? How do I know when I have a problem?
Well, in terms of tennis elbow belongs to a big group of problems called tendinopathy, and tennis elbow in particular, because it affects the outer part of the elbow, causes pain over the area, and it can spread over, including downwards along the muscle, and it's usually painful when you do certain activities.
So it can be quite debilitating.
Yes, of course.
What are the current treatments available for tennis elbow, both invasive and non-invasive?
Okay, non-invasive are the ones that we use initially, such as anti-inflammatory medications. Patients can be referred for physical therapy. Well, in a way, it's a little bit invasive, but a lot of patients do respond well to initial hydrocortisone and lignocaine injection. Okay, but failing which, sometimes we may have to progress to surgery, and around 10 to 20% of patients that we see eventually do need surgery.
So why is this new procedure that you've come up with the better alternative?
Well, because it is actually more targeted to the actual causative area, which is believed to be the scar tissue. We can actually target it, and it can be done under local anesthetic. Through a small step incision, the wound heals faster, and patients need less painkillers after the procedure and can return to their daily activities a little faster.
So it's a minimal downtime procedure and a quicker recovery as well, would you say?
Yes.
And it only takes about, what, 15-20 minutes, is that correct?
Yes, round about there.
Okay. Surprising results from the study. Anything that you found that surprised you or was interesting? For example, success rates.
Well, we were actually pleasantly surprised that the procedure was so well tolerated. Initially, we thought that it's going to be a minor discomfort. As attested to by some patients, they say it's even more comfortable than having an actual injection over the area or injection for trigger fingers. That's from one of my patients. And I was also pleasantly surprised that there was minimal need for painkillers after the procedure, and the fact that the wound healed so well, and at this point of time we are around 2 years post the initial group of patients, and the patients have actually done very, very well. The outcome has been maintained.
So not that many patients had a relapse then?
Well, hardly any.
Wow, that's impressive. So I understand that this is, or SGH is the only center in Asia that offers this procedure as well. Is that correct?
Yes, at this point of time, yeah. We are hoping that more centers will come about.
So is this procedure only for tennis elbow, or can it be used for other conditions as well?
The device is actually patented for tendinopathy all around. It's commonly used for tennis elbow, for tendinopathies around the knee, as well as the foot and ankle region.
Oh, so that's currently being offered at the hospital as well, or are you just focusing on the arm for now?
We are going to offer the other options to patients as well, but currently the other options are being performed in the United States quite widely already.
Okay, so who would be the most suitable candidates for this? Is there anyone who might not be able to undergo this procedure?
Well, largely patients who are about to undergo surgery, and we offer these as an option. Usually contraindications would be those with an active skin lesion or infection over the area. And relatively, I would say that those without a targetable a scar tissue based on ultrasound may be a little less suitable. But other than that, most patients should be able to go for the procedure.
All right, one last question. Is it affordable?
Quite highly affordable.
All right, thank you very much, Doctor, for coming in. It's great speaking to you. And that was Dr. Joyce Koh from Singapore General Hospital telling us about a new treatment or procedure for tennis elbow.